Hello, everyone. This is AZ, the host of the Fire Rescue Wellness Podcast. I am here with episode number 41. And today you're going to hear from Dr. Jonathan Chung. He is an individual. When I put out the bat signal and said, I need to talk to someone who is an expert on traumatic brain injuries and concussion, this is the name that came back to me. And so as firefighters, you got to realize that there is the potential for you to experience a concussion or even a moderate or major traumatic brain injury. And so having some knowledge gives you power, and it also gives you hope. So sit back, relax, take a listen to Dr. Chung. I hope you enjoy the podcast. Thank you for joining me on the Fire Rescue Wellness Podcast. I'm your host, AZ. I find the research and resources and then provide the fire service with the so what, now what, to ensure the health and well-being of every member of our profession. Together, let's thrive. Hello, Fire Rescue Wellness Podcast listeners. It's your host, AZ, and I am here today with Dr. Jonathan Chung. Dr. Chung, say hello to my listeners.
Hi, everyone. Thanks for having me on the show. I'm glad to be here.
I'm so excited to have you, and I always like to give full disclosure. The good doctor recorded with me once already, and we had some serious sound issues, so I am so additionally grateful for his extra time. So thank you, Dr. Chung. We're going to hop right into it, though. Who is Jonathan Chung?
So a little bit about my background. I am an upper cervical chiropractor, but I also have a background in neurology. So a lot of my practice, I focus on traumatic brain injuries. So we do a lot of post-concussion rehab. We also like to work with patients with vestibular disorders, meaning things like dizziness and vertigo. We also work with headaches, and we also work with problems of the autonomic nervous system. So if you've heard of things like postural orthostatic tachycardia syndrome, things like that, then those are a lot of the things that we focus on practice and things that I really love taking care of. On the personal side, I'm a big believer in exercise. So I'm a little bit of an exercise junkie. So a lot of my biases are going to be focused on like using strength and conditioning as part of a program to help improve the function of the brain as a whole.
Oh, I love exercise junkies. And really quick shout out. I almost forgot. The whole reason I am connected with Dr. Chung in the first place is that my girl, Katie Dabrowski at Old Bull Athletics, she said, you are the person that I need to talk to about TBIs and concussions. So that's what we're doing here today. That said, Dr. Chung, what sets your soul on fire?
So one of the biggest things that is really inspiring to me is taking someone who feels like that they have no options for getting hope or getting better, and we could find ways that we could use their lifestyle and use exercise and movement as medicine to help these patients, see hope that their lives can be better by increasing their fitness, but also using exercise as a powerful stimulant to improve the functionality of the brain. So I love the way that we can use both chiropractic and exercise as a way to help the brain work better and help people overcome a lot of these issues, especially related to brain injury, which is where my big passion is.
And Dr. Chung, I heard something in your answer that really gave me pause, which is hope. And hope is something that it's just so important with anything we've got going on, whether it's personal, professional, or disease processes. Having hope is so important.
For sure.
All right. And last rapid fire question. How are you changing the world?
For me, I like to help focus on inspiring people on the beautiful benefits of strength and conditioning in a way that people see it not only as a way to get in shape and to lose weight, but that really exercise is brain medicine. And the more people can understand that, then the more they can see like, hey, the purpose of you going out on this 3-mile run, or the purpose of you like picking up these weights and doing squats isn't necessarily so that you can lose weight or have a better, fitter body, which are all great things. but you're actually creating a brain that is going to be resilient throughout your later years in life, because there's so much evidence that suggests that people that are physically fit are going to be more resistant to dementia when they get into their later ages. And that's one of the things that a lot of people are just quite frankly scared of, is like, more than cancer, more than heart disease, they're afraid that they're going to lose the things that make them themselves, meaning their brain, their cognition, and their memories. So if there's one thing that we know for sure that seems to be protective of that, and that's exercise.
Dr. Chung, you just nailed it, because I've been thinking a lot about brain function and dementia, and I'm 52, but I'm already thinking about it, so I'm so glad you brought that up. So what I really wanted to bring you on to discuss, in addition to just the brain in general, is traumatic brain injuries, because my population of firefighters, we're quite apt to get them. And in most cases, we usually get the diagnosis that it's a minor TBI. But can you actually tell us the difference? I understand that there's minor, moderate, and major TBIs. Can you just define for us what the differences are?
Sure. So when it comes to a minor TBI, most people will use minor TBI, so a mild traumatic brain injury. It becomes fairly synonymous with concussion. So when people think about concussion and mild traumatic brain injury are used fairly interchangeably in the peer-reviewed literature. So when people think minor TBI, you want to think like you got went out and you got your bell rung. It didn't need hospitalization. It took a few days to a few weeks to get a recovery. And then for most people, you end up feeling a little bit better. For moderate brain injury, you're going to have some physical signs of the injury to your brain. So you might see like a contusion on the brain. Typically, they may be associated with some level of skull fracture or leakage of cerebral spinal fluid. And for your more severe brain injuries, these are patients that will typically go into a coma or lose consciousness for a prolonged period of time. And there's usually more profound physical deficits and the immediate aftermath of a severe brain injury. And the outcomes with a severe brain injury are obviously, not as optimistic for full recovery, but there is certainly room to improve someone's life even after a severe brain injury.
There's that hope that you mentioned earlier. I love that. So when I was growing up, playing sports, there weren't a lot of what we would call concussion protocols now, and I understand that concussion protocols vary from sport to sport, state to state, from professional to amateur. But can you sort of give us at least a bird's eye view of what is a concussion protocol? What does that even mean?
So, concussion protocol was built into modern sports because certainly in the 70s and 80s, people would kind of think of a concussion as this minor thing that you could kind of shake it off, and then you could go back into the sport and play again. So that's just the story of a lot of these old school football players who, may have suffered multiple concussions within the span of a game because they didn't have spotters and on-site or sideline doctors to be able to help make a decision about whether this person should be playing. So we got developed these concussion protocols to try to help prevent people from suffering additional injury while they're playing their sport. So a big part of it means identifying when you think someone has a concussion, because whether it's an athlete or whether it's a professional, a lot of people, especially if see yourself as very tough, they don't want to show weakness by coming out when they've taken a blow to the head. And a lot of athletes will really want to stay in the game, even though it's not in their best interest. So it's up to people that are hired to do these jobs to act in the patient's best interests instead of letting the patient make that decision for themselves. So typically there's a athletic trainer that will spot some type of sign of a brain injury. So if someone recently took a hit to the head or neck, and you notice that when they get up, they stumble a little bit. So that's like the thing that they saw with Tua Tagovailoa with the Miami Dolphins that happened to him several months back with his concussion. So they stumble or they trip up, and they look a little bit disoriented after taking a hit. Then it's the spotter's job to recognize that and immediately pull them out of the game. And then they're going to do a variety of testing on the sideline to determine if the person had some type of brain injury. So they might look at their balance, they might look at their eye movements, they might see some basic cognitive tests like where are you? Do you know what year it is? Who's the president of the United States right now? Or they might have you say, like, remember these 3 digits, recite them to me backwards. So they'll do some very basic cognitive tests. And if the person has a baseline of a healthy response to those things and you compare them and you notice that they're significantly off that baseline, then you're usually going to assume that there's a concussion diagnosis and they're going to pull them off the field. And once someone is identified as having a concussion, then you're going to take them through a series of steps in order to get them back to return to play or return to work. And that's going to be to start to make sure that the patient is asymptomatic, but even beyond being asymptomatic, you want to notice that their cognition is starting to come back to normal, that they could tolerate exertion without becoming symptomatic. So putting them on a treadmill and having them walk and not exacerbating their symptoms. And then you gradually move from just gradual exercise to similar activities. So you might get them to do sports-related activities without contact and eventually get them back into full sports contact and full sport activities once they feel like your brain is safe. And the reason for that is to prevent something called second impact syndrome, which can be quite devastating for athletes in terms of their future brain health.
You said something that really got my attention there. You said that these athletes, they want to be tough and they want to stay in the game, which they do. But you know who else wants to be tough and stay in the game? Firefighters.
Absolutely. Absolutely.
And so, we don't have official concussion protocols. We probably should, and we can talk about that next. But what can we do, as most of us are first responders at the minimum, we're EMT basic or even EMT paramedic. What can we do when one of our coworkers, quote unquote, gets their bell rung?
So one of the things that's important is to recognize what someone's baseline behavior is versus what the behavior looks like after they've suffered some type of suspicious impact. So if you know someone is like fairly athletic, they usually don't have difficulty with their balance, they're not used to seeing them stumble, and let's just say that they're out and something kind of looked like it grazed their head, or you're working with a patient that's, can get a little bit violent and they might have taken a headbutt to the head. Like, it might not seem like a big deal, but if you see the person and they're stumbling a little bit, if you notice that their gait is a little bit wider or that they're freezing with different parts of their gait pattern, then these are some of the first signs that can show up when someone may have some signs of concussion. Another thing to kind of look out for is if someone actually takes a blow to the head and they actually go into something called a fencer's response, where their head starts to turn, their arm starts to go limp, and they start to fall over. Even if they don't lose consciousness, that's actually a clear-cut sign that they've suffered some type of brain injury. So noticing some of these signs can help you identify that, okay, this person likely suffered a concussion. And instead of letting them kind of push through work, we need to kind of separate them from the work and say, hey, I think, you probably took a concussion. We're going to probably just let you rest here for a bit. We'll probably call it a day on work-related activities. And then that person will typically, if you suspect a concussion, will need somewhere between 36 to 48 hours of just, rest time to help their brain recover, and then get them started to, basic movement and start to get them back to normal activity again afterwards. And then, follow that up with seeing a doctor or a concussion specialist to see what level of brain injury did they have and what things would they need to focus on in order to rehabilitate it, because a lot of the evidence suggests that early treatment for some of these head injuries lead to better outcomes.
And I'm gonna go out on a limb here, and by all means correct me if this isn't accurate, but I would assume that much like an athlete, a firefighter that experiences a concussion would also have the danger of the second impact syndrome and would need to be rehabilitated in the same fashion for successful, quote unquote, return to play. Is that accurate?
Yeah, that's accurate. The biggest thing is, what's the likelihood of getting that second head injury? If you're playing a sport like football, the likelihood of taking a second head injury is really high, right? Whereas other sports, they might be a little bit lower because head contact isn't that common. So it also depends on the nature of your work. And, when we talk about second impact injury, like understanding the physiology of a concussion can be important. So when you have a concussion, you have all of these neurons that start to fire heavily inside of the head. And whenever neurons are firing heavily, they need a lot of energy in order to fuel that level of activity. But a lot of people, when they have a concussion, is they will go through vasoconstriction in some of the arteries that go up into the brain. So you have this energy mismatch where your neurons are firing very heavily, but then the blood flow isn't getting glucose and oxygen up to the brain in time. So you're running at this energy deficit, and that's what's driving a lot of this concussion physiology. While the patient is in that concussion physiology, they may become asymptomatic, they may feel okay, but as long as that energy mismatch problem is there, they become susceptible to an additional impact, which can really catastrophically worsen that issue. And that's where you could have more permanent injuries to different neuron populations in the brain that could cause permanent damage.
You just explained something so clearly that I have never understood. Thank you very much. That makes a lot of sense. So let's transition to obviously, we would like to recognize early, early recognition of concussions and aggressive treatment. But let's go for a second to any further complications of untreated concussion. So, as an example, as a probationary firefighter, I took a spill off of a ladder in a training tower. I fell maybe, I don't know, 4 or 5 feet and hit my head on the concrete training tower floor and shook it off because I'm in academy. I have to shake it off. But are there any complications from A, not recognizing that, and B, not treating that potential concussion?
So the good thing about it is that for many concussions, there can be a natural recovery without any lasting injury. So that's the good news about a large percentage of concussions. And a lot of it also depends on your baseline fitness. So if you're someone that has a fairly high level of baseline fitness, your brain is generally going to be more resilient. Or if you're someone that's a little bit more sedentary, then your brain is going to be a little bit less resilient. There are observational studies that show that some patients with concussions will develop, higher risk of psychiatric issues like depression and anxiety and things along those lines. And in some like really aggressive contact sports that have multiple head injuries throughout the course of their career, that's where people start to develop a little bit of worry about things like chronic traumatic encephalopathy and other neurodegenerative diseases as potential downstream risks. But those are typically isolated more towards people that are in contact sports and not necessarily someone that suffered a concussion and then recovered and then didn't have any other issues with that. So I would say if it's a one-off concussion, you can be reassured that most people can and do recover fairly well, especially with good rehab. But it's really like the repetitive contact, the repeated concussions that can be more of a long-term threat to someone's brain health.
Gotcha. And I just want to I want to underline in dark red marker what he said. The more fit you are at baseline, the better your potential outcome. So here's yet another reason to take really good care of that body that carries your brain around. All right. So let's talk for a minute about, when we talk about disease processes or things that can happen to us, we always want to also look at upstream prevention principles. In terms of concussion or traumatic brain injury, are there any prevention principles that can be impactful for us, especially as firefighters?
So this is actually a subject that's become a little bit interesting because there are many things out there that say they prevent concussions, but from a realistic standpoint, the only way to prevent a concussion is to really limit the impact to your head and neck and shoulder area. When it comes to some things that may have some benefit, but it hasn't quite been fully proven yet, neck strength appears to be something that is beneficial for prevention of concussion, as there's been studies that have shown that high school athletes that have thicker and stronger neck muscles tend to have lower incidences of concussion than patients that have weaker neck muscles. So something like a neck strengthening program has the capacity to limit how much your head moves on contact, and that could, prevent some of the movement of the brain that, causes a concussion to happen to begin with. One thing that one of my mentors has published some studies about is the effect of eye movement training for concussion prevention. So with his athletes, he goes through a visual training program where he trains patients' eye movements, and it helps them train their peripheral vision and their visual awareness, because if you are more aware of your surroundings, then you could become more aware of potential threats that might hit your head. So if you, like, for example, if you took a head injury because something came from your side and hit you without you knowing, if you have really good peripheral vision and your eyes pick up on this object before it actually hits you, then you can actually move your head out of the way so it becomes just a grazing hit instead of one that can actually concuss you. So there's some room to say that eye movement therapies might help improve your visual awareness of things. And the last thing are some, experimental devices like neck collars and things of that nature. But those aren't necessarily proven quite at this time, but there are being studies underway to see if they do have benefit in concussion prevention.
That's really interesting. And I want to ask you, I read it wasn't multiple studies. I believe it was only one study on the benefit of creatine with concussions. Now, would that be mostly post-concussion as a result of that extreme energy need in the brain, or would taking creatine prior to a potential head injury also be potentially beneficial?
So the studies that we know now are showing that creatine after head injury may help the brain work a little bit better because of that energy deficit. And there's other studies that have shown that when you put the brain in a state of heightened stress by taking creatine, that people that take creatine can actually perform quite well under stress while taking creatine, whereas patients or people that are not taking creatine perform worse when under that stress. So they took a group of people and they put them under hypoxic conditions, meaning there's less oxygen in the air, which causes you to breathe faster. It puts you in a little bit more of a fight or flight type of physiology. And the people that took creatine were actually able to maintain their cognitive function, actually improve their cognitive function during that stress test compared to people that didn't take creatine. So there is some evidence for that. And it's something that I do recommend for my post-concussion patients. In terms of before a concussion hits, there is some preclinical data in NFL populations where taking an omega-3 fatty acid supplement reduces some of the biomarkers that appear in patients with brain injury. They don't know if it's clinically meaningful yet, but it gives you some suspicion that omega-3 is something that is safe, it's well tolerated, it has cardiovascular benefits. So it's one of those things that you could probably take, and it might help be protective of brain injury if they were ever to occur. But we don't know if it actually does anything in terms of actually preventing symptoms or any future onset of brain injury problems.
Very, very interesting. Thank you. I want to circle back to a few minutes ago, I said, most of us are first responders, EMTs, even paramedics. What I didn't mention is that we follow what's called standard operating procedures, which come down to us from our resource hospital. So whichever region we practice in, we practice under the license of a physician who gives us these standard operating procedures. And I just want to emphasize, I think it might be really important for us to have a standard operating procedure for concussion, not necessarily in the citizens that we're responding to, because we're not going to observe what happened, but a standard operating procedure for concussions that we would suffer at work. What do you think about that?
I think it would be a great thing, especially where any line of work where a potential head trauma is, it's an expectation of being out in the field that it could be a possibility that's going to be out there. I think it'd be a good idea to have something like that, especially when it comes to concussion, where there are some sports guidelines that can kind of set the tone for what a concussion guideline would look like. It would include things like, a short-term rest period after the injury of 24 hours, starting some very light physical activity within 48 hours, and to pursue early treatment using exercise, vestibular therapies, cervical therapies as ways that you could use to help get a person back to work and being asymptomatic sooner. So I think there are some things there that can be taken from the sports world that can apply to the workplace too.
Listeners, you heard it first. Illinois Region 8, Dr. Wilson. We're going to talk about this. I don't think Dr. Wilson listens, so I'm going to have to send him an email. I wanted to talk to you. We've kind of hit on this sort of the rest period and then light physical activity and then a graded rehab prior to return to work. But can you speculate what that might look like for a firefighter? Because not only do we have to do tasks of physical prowess, we'll call it prowess, but we also have to be able to think very clearly because we do make life or death decisions in austere environments. And so I would think that we would need to fairly aggressively attack that graded rehab. Can you speculate what that might look like for a firefighter?
Sure. I would say like some of the protocols that have been well established is there's this idea, it's called some symptomatic or subsymptom threshold exercise. So within 48 hours of suffering a head injury, what they do is something called a treadmill test, where they will put you on a treadmill and you are going to walk and you're going to stimulate your heart rate to start to rise while you're doing this physical activity. And basically, what they're going to do initially is they're going to find the point in which your heart rate rises and it causes an exacerbation of your symptoms. So let's say that you had headaches from your concussion, and then you're feeling okay on day two. You go on this treadmill, and as soon as your heart rate hits 120, then your headache starts to increase. And what they would do is they would take your heart rate and have you exercise at about 110 beats per minute. And you would exercise at that pace for about 15 to 20 minutes per day so that you encourage this blood flow pattern to happen, nice and easy on your system. You gradually start to increase the intensity at which you could exercise without becoming symptomatic. So for some people that could take, 3 to 5 days. So if you have like an exercise bike or a treadmill, or you're just going to go for a walk, you can monitor your heart rate, and getting your heart rate up to a point where it doesn't cause symptoms is probably a good place to start. And then going through and working with, a doctor or a neurologist who has a good understanding of contemporary concussion paradigms and protocols, getting them to refer to a physical therapist or a chiropractor with concussion rehab experience. Then they can do things like vestibular therapy, which is going to help with the coordination of their balance. They could do cervical spine type exercises and therapies that help improve how the neck is functioning. And then there are specialized types of chiropractors, physical therapists, or optometrists that will do vision therapy so you can help improve the coordination of your eyes, because these three systems in particular account for many of the symptoms that people experience after a concussion, and a lot of them can be improved using a guided exercise approach towards improving the functionality of those systems.
So what I'm hearing that's really important is finding that neurologist who practices in more of the 2023 fashion as opposed to the 1981 fashion.
Yeah,
Would you agree?
yeah, absolutely. And here's why that's important is because in a lot of the clinical studies that have been done in the last 15 years, it's shown that resting too much after a concussion is actually a net negative on the time to recovery. And there's still quite a few doctors and neurologists out there who aren't up to date on the current literature on concussion, where they will recommend like strict bed rest, strict cognitive rest until you're asymptomatic. But the truth is, like, the patients that actually start to get back towards their normal activities sooner actually do a bit better. We just want to make sure that they have some guidance from a professional to be able to help guide their physical activity recommendations in a way that is safe for that patient. So yeah, if you're seeing a healthcare provider and you've had a concussion and they say you need strict bed rest until your headache goes away or until you stop feeling dizzy, and that is really old school thinking, and it's not really best practices now. So you want to find someone that is understanding that rehab is actually the best medicine for these mild brain injuries.
And side note, off topic, if you are physically, bodily injured, same thing. When I sprained my ankle in the late 80s, the protocol was stay off it, don't move it, ice it, and take a lot of ibuprofen. Well, if your practitioner is still treating you that way, the 1980s called. They want them back. So, Dr. Chung, you practice in Florida. You see patients in your office. What city is it again?
So I'm in a town called Royal Palm Beach. It's on the outskirts of West Palm Beach, Florida.
Okay. And do you practice remotely or virtually at all?
I do see some patients remotely, but overwhelmingly I see patients in office. For
Okay.
patients that are like not in my local area, I could certainly provide guidance and help patients find providers that may be able to see them personally. So, helping to guide exercise recommendations, I'm pretty comfortable with, but there are some times, especially after someone takes a head injury, where there are physical interventions that can be beneficial for the patient's recovery. And that's where like having a practitioner that is available can be quite useful.
Absolutely. Sometimes you just got to go hands-on. That makes sense. So for my listeners who potentially have suffered a brain injury or concussion, or God forbid, might suffer one in the future, what types of credentials would you recommend that they're looking for in these practitioners when they're looking for a doctor, a physical therapist, or a chiropractor?
So in the physical therapy world, there are neurophysical therapists. So someone with some neurological training is usually going to have some background in this. Also, vestibular physical therapists will have some background in this. So those are good assets. For the chiropractic world, chiropractors that have a diplomate in chiropractic neurology or have a diploma or some type of training in functional neurology or even upper cervical chiropractors can be good resources for helping to manage concussed patients. And in terms of traditional doctors, like a lot of sports physiatry doctors can have some concussion training because they have a broad sports medicine background. And also a neurologist can also have some background on this as well. But again, you have to when you're talking to these doctors, you have to make sure that they see like rehab as a source of first line of healthcare, as opposed to using strict rest and medication.
So, my listeners, you have to, as with everything, be an advocate for yourself. So, Dr. Chung, what I always like to do is wind up the podcast with one of two things. Either, is there something that we should have talked about that I missed? Or do you just have a final thought that you want to leave the listeners with today?
Yeah, and I think we talked about one of the things before, and this dovetails on some new work that's going on in the subject, is that having a healthy baseline level of fitness helps you to have better outcomes across almost any condition that you could think of. And concussion is likely no different from that, and brain injury is no different from that. If you are physically fit, meaning you have good aerobic fitness and you have good conditioning of all of your muscle tissue, then your likelihood of recovery becomes better. And that's why they think that athletes that suffer a concussion have a recovery time of anywhere from 14 to 21 days on average, where people that suffer concussions outside of the sporting field may have recovery times that take 30 plus days or more. And this is a pretty big difference when you look at it at the population level. So having a healthy level of fitness is probably something that will benefit you not only in recovery from brain injury, but it helps you recover if you ever need surgery. It helps you recover if you ever need, God forbid, you ever need a cancer treatment or treatment for autoimmune diseases. Like there's just so much to be had just by having a higher level of baseline fitness that is protective across multiple diseases. So that's one of the best things you could just do for prevention in any level of health.
So I'm going to reiterate and quote Dr. Chung. A healthy baseline will provide better outcomes in almost any condition. With that, I think we can drop the mic. This has been AZ and Dr. Jonathan Chung, and we are officially out.